Hi. So as you know, we have these very interesting conversations with promising founders from very, very promising startups. Today, we are going to have a chat with Ramoji and Laksmoji, founders of RXpert, a business that aims to revolutionize the way medicine and healthcare is being administered in the country, not just by use of technology, but by making sure that the patient needs are so very well taken care of that it's almost as if they say, if the patient can't go to the super specialty expert, can the super specialty expert come closer to the patient? So without much ado, I'm going to jump into our rapid fire. But before that, a very warm welcome to Ramoji and a very warm welcome to Laksmoji.
Thank you, Sachin. Thank you.
Thank you, Sachin.
Great. So here is what we are going to kick off this conversation with. I'm very, very curious to know what exactly is the pain point you guys are trying to attack and address.
Sure, Sachin. Thank you for that kind introduction. And as you said, this is exactly what we were intending to do. If you cannot go to the expert for some reason, probably you're staying in a place where there is no expert available immediately. So this is where we take the expert to. Okay, so that is the very foundation of RXpert. So to explain it a little more, it is more of a super specialty e-clinic. In the sense, we have the doctors, we have general physicians available all across, but super specialists are there only in the cities. So many people from town, for them to reach to super specialists, it's not going to be easy. So what RXpert does is connect the super specialist and the patients, while the general physician is also part of the whole process, and provide super specialty e-clinics across the country. This is what RXpert does precisely, Sachin.
Awesome. So how is this getting deployed as a solution? What exactly are the pieces on the ground, pieces on the technology? Basically, what exactly do you guys do?
Yeah, well, this is actually like a kind of digital connectivity between two qualified doctors. Of course, as Ramoji said, like one side limited qualified and other side highly qualified doctors. The connect is basically through digital route. We have developed a kind of software platform embedded with a lot of the medical features in that. And that connectivity is through cloud, and now anywhere any doctor can access this when provided the doctor is authorized to use. So today in India, like digital connectivity is not a big problem. What we had 10 years ago, thanks to the digital revolution, that is the connectivity we have, and people are happy with that, and that's it. I mean, we're doing good with that. That's what I must say.
Sure. So if you had to describe the solution, I was a little, keen to describe to the viewers how you have kind of deployed the solution. I know you are currently in the experience center that you have created, but what exactly, does the solution look like on the ground? Is there an MBBS doctor with whom you have tied up? Is he the person who's like the first contact point for patients? How does the connecting link or the bridge with the super specialty expert take place? Why don't you describe the solution a little more in details, if you don't mind?
Well, see, the patient's footfall is basically into these general physicians. Most of them are, as you said, MBBS doctors, qualified doctors. But the patient is coming to the doctor with a chronic problem, or again and again with the same problem, I don't know, a kind of multiple problems. Doctor will have to take the consent of the higher specialty to proceed in the treatment in advanced way, be it a procedure or be it a medication. Then that time what happens, like conventionally these doctors in small towns and villages, they expect the patients to travel all the way to city and consult the doctor. So the traveling part we are cutting down, because we are making those city doctors, those are the super specialist doctors who have had a good training in some of the best medical colleges in India and abroad. We are making these doctors available to the patients of the general physicians in small towns and villages. That's a connectivity we have. Okay, with that, like, the basic thing what we have in our system is that, it's a connect between two doctors. That's what we have to emphasize on. It is not just connecting the patient with the doctor and, okay, you talk to the doctor, nothing of that kind. It is like, doctor is hand-holding the patient and taking to the super specialist virtually. That's a solution we are giving.
Sachin, I'll add a couple of things into it.
Sure.
Laksmoji is sitting in the virtual clinic in the sense that's a real clinic, okay, where patients come. You can see what kind of the services they're being provided. See, what happens is, suppose I'm a general physician, right? I see about 50-60 patients every day. Good about 10-12 of them are in a way beyond me, in the sense I'm not competent to treat them. Okay, because I'm just probably the MBBS doctor, right? Now, these people require intervention by a super specialist. So, easiest thing for me is to advise these patients to go to the city and meet a specialist. But that's not going to be all that easy for the patient. And the patient will have to travel all the way to city, having already been suffering with the pain, and travel will be additional pain, and somebody has to accompany the patient. He or she cannot go alone, and the cost involved are related to the travel and stay. And then, of course, the doctor, they don't know, they have not met before. So a lot of things will come in between, and then patient will keep postponing his visit to the doctor. Specialist. So in that case, what happens is the very critical treatment is getting delayed. So RXpert connects the doctor, that is me. And suppose if you happen to be a super specialist, RXpert will connect me and you to examine the patient together virtually. So when the actual examination by you happens, the patient is with me. I am sitting, in front of the system, and then you are coming online virtually, and both of us will decide the right course of treatment for the patient. This will actually avoid the patient to travel for the initial assessment all the way to the city.
Awesome. So what are the upsides, logically speaking, and as per the wildest dreams in your assessment?
Business upsides?
That's right. Upsides for RXpert.
Yeah, basically this is a digital healthcare platform. So we facilitate the digital consultations, and then follow-on treatment, and then the medical alerts and all that stuff. It is not just a video consultation. It has got many features which will take the patient all through from consultation till the end of treatment. That apart, Sachin, what I see is that we, over a period of time, we are going to build a huge database. In the sense, just imagine if we have a database of, say, about 10-12 million patients. Okay, that will be we want to actually use it for right purposes or whatever. And again, when we empanel the doctors, let's say about 1,200 doctors, a lot of pharmaceutical companies will conduct the CMEs, they call continuous medical education programs, or product launches. So all these things can happen virtually without people having to meet and spend a lot of money. So there are, and then of course, if a doctor wants to present his case to the rest of his community, and he will have huge audience available through our platform. So I mean, the biggest thing is probably the data, what we create, and that will lead to a sort of artificial intelligence tools. and then of course the virtual meetings of the doctors and product launches. So these are all the big benefits other than of course the consultations.
Sure. What do you think are the risks in this kind of a business, Ramoji and Laksmoji?
See, I would call them as challenges more than the risks. Okay, of course, risks are there in any business. We have the risks. Challenges are there, which are actually, addressable. Okay, for such a vast country wherein the little urbanization and a more of rural, biggest challenge is network, like an availability of the network. But in last 1 decade or 1.5 decades, we've seen huge transformation in the development of the network. Over a period of time, maybe in other 5-6 years, this challenge can be definitely nullified, and the network is not an issue. And one more risk, yes, of course, this is a tech platform which is easily replicatable. Okay, but we have taken one thing into consideration that okay, to survive in this platform, we need to upgrade our software every now and then, and we have that process in place. Every month, if you see our software, you'll see some new features. Okay, so that's how we are facing the challenges. Risks, yes, this business model is duplicatable so easily, but will not make it happen that easily, because we will be 3, 4, 5, 6 steps ahead of someone who is trying to replicate that.
I'm sure.
Very well said. In terms of the network, Sachin, if you go to the villages, in fact, they are effortlessly, easily downloading all the, Netflix, movies, and then, Amazon movies. I mean, see, its network is phenomenal in those places these days. I think that's not going to be, risk anymore. Like Laksmoji said, there are, very, people can start. It's not a rocket science, though. People can start, but we welcome. So the opportunity is so huge that we need hundreds of players to come and then participate in this.
I would completely agree, and I think one of the factors that's going to contribute to the growth of your business is the bond or the trust that develops over a period of time between the patient and the local doctor, and the fact that the local doctor could get one of the best surgeons or the best experts in conversation and kind of resolve the query without the patient having to travel hundreds of kilometers and staying in some in a unknown city and things like that, because the hassle in case of a sick patient is not just to the patient but to the relatives. So I'm presuming RXpert is going to cut down all of that hassle, the inconvenience, not to mention the expenses that the family has to bear. Great. I wanted to come to a little bit of the the numbers in terms of the TAM, the SAM, the customer acquisition cost. If you could throw some light on these 3 things.
Yeah, well, Sachin, TAM, the addressable market is huge. Okay, because we are a vast country. Most of the population is residing in small towns and villages. See, to our estimate, in India, we have about 900 million people living in those areas which are not accessible to super specialty services. They have the primary care, government services there, private services there, general physicians are there, but as well as super specialty services are concerned, they don't have easy access. All of them will have to travel. So one more reality is that out of every million, about 1,000 to 1,200 patients are looking for some super specialty service every day. Okay, so that gives us a massive figure of throughout India, about 10 lakh super specialty consultations happening every day in the country. Okay, I mean, these consultations, they are traveling from small towns to bigger towns. So this is the total addressable market. Okay, then when I say about serviceable market in that, okay, I may not immediately get into all these 10 lakh consultations, but even if I take 20% of them are comfortable with digital platform rather than, no, the comfort is mostly with the doctors. It is not just the patient because the doctor is the one who advises them. Even if I take a very, very pessimistic figure of 20%, okay, that itself is 2 lakh consultations a day. That is a serviceable market I'm looking at. So we need a lot of centers. We've already identified in selected states that every center that has got a population of 70 to 80,000 people is one potential center to put our flag and start the services. That's a kind of serviceable market we have.
Sure. I know your backgrounds, but it would be interesting for the viewers to know as well. So my next question is, why are you the best team to execute all of this?
Yeah, Sachin, we feel that we are best team. The reason being, see, the two co-founders right here, me and Laksmoji. I have got about 2 decades of experience in the healthcare. I have been part of Manipal healthcare system, which grew from one hospital to whatever it is today. And I've been part of that journey. And then more importantly, the digital healthcare has been my passion for very, very long. I would say that domain expertise with a reality as to what's happening, what is required, and then by virtue of our association with healthcare, we know what are the expectations of the doctors, both in towns and also in the cities. So I would say the passion coupled with domain expertise and the will to scale is probably making at least me one of the best teams that is built by Laksmoji and rest. And probably Laksmoji, if you want to take it on from here.
Yeah, I'll tell you, we are definitely the best team because we have put the best brains put together. Between me and Ramoji, we have more than 5 decades of healthcare experience. Okay, covering the spectrum of healthcare services, be it the hospital, be it the diagnostics, be it the the pharmaceuticals. We are, I mean, a total cover to the healthcare industry, right? And we believe in one thing which we have practiced in this also. We don't believe in dreaming something and get up in the morning, sit on the drawing board. Before even touching the keyboard for development of the software, okay, we did the extensive surveys in the field to understand what is the level of the need that is there for this kind of platform. We had taken the opinion from medical people, non-medical people, some influential people in the small towns wherever we did that some educationalists, some we visited some officials. We had taken a lot of opinion before starting the development of this product. So with that, if we were okay team before the start of this process, now we have definitely become the best team. We've learned through the process, and we are implementing all that as it is the way it is required in the market.
Sure. Laksmoji, do you want to expand a little bit on some of these diverse set of experiences and accomplishments that you have kind of notched up over these many years? It would be very interesting for the viewers to know a little bit more on that part as well.
Sure, Sachin. See, I've had about 3 decades of healthcare experience, right? My profession started with healthcare and still continuing with healthcare. See, I have been the active player in 1.7 billion pharmaceutical market in India. I worked for the companies of different sizes and different market penetration. Okay, Then my teams had dealt with not less than a lack of doctors in different specialties, right? Uh, that has given me immense confidence in that one aspect, that what service is definitely needed at this point of time, and then how we can escalate that to the needy, right? So be it launching some notable pharmaceutical brands, and be it handling, some specialty businesses, or handling, use field force activities involving the doctors, like conducting the CMEs, some events. I think all these have given me immense confidence in me to handle the digital healthcare platform, which is the need of the hour. Okay. And mentoring some startups, mentoring some, running companies. Okay. So this is the association I have with healthcare industry. And I'm glad I'm continuing with that. And, I have other 25 to 30 years in me to service the healthcare industry. Forget about my age and, the retirement. Okay.
Sure, absolutely. I'm sure both of you must have had a very interesting set of conversations from doctors, from patients, from their relatives who must have come in touch with your service offering, must have experienced some of it. In the paucity of time, it may not be possible to cover everybody, but any key verbatims, any key highlights, testimonials, feedback that kind of warmed your heart in terms of the validation that came through from the horse's mouth. Anything that you would like to share?
Sure, Sachin. I would give one instance where I was personally touched very much. Somebody was thanking us profusely after having gone through the RXpert consultation, all that stuff, for his mother. Right. He was, telling, I happened to be there when we talked to them because we were doing an event, and then I went there, and this guy came and talked to us. He was talking to a manager, and that manager brought him to me. Okay, I could see the, sort of tears, in his eyes. He was telling that, for about 5-6 years, he was trying to take his mother to the city for a super specialist consultation, and she was not agreeing. And because naturally, when it was a painful journey, like we discussed a while ago, and the cost involved, all that stuff. These guys, they were not actually so much worried about the cost. Unfortunately, healthcare cost is unplanned for anybody, but they were more worried about two things: how do they take her to the city, and what would be the expected outcome. So these guys said that, sir, for 5 years I was trying to take my mother to the city, but I couldn't get, and this was a wonderful opportunity. I'm very happy. Thank you very much. So when he thanked, it was not just thanking. You could, when you look into his eyes, you could see, tears. So that is the kind of a testimonial I can talk about, Sachin. Not that, somebody telling that, oh, you are doing a wonderful job or whatever. This is the real, real testimony for what we do. And we have many such instances. Okay, of course we have received lot many, what do you call, praises, and then some suggestions also from doctors to tweak this way or that way or whatever. But the real testimony comes from the patients who got huge benefit, and doctors also, the general physicians, who said that, sir, I was actually not able to treat all these patients. Today I can confidently help any patient with any problem. So that is a real, appreciation what we have got, Sachin.
I completely agree, because those of us who stay in the urban context perhaps do not get the magnitude of the problem that is there in tier 2 and tier 3 cities when it comes to connecting the patients with the specialty doctors, with the experts, and the amount of hassle, the amount of uncertainty, and the sheer, like you mentioned, large number of patients who need that expert medical attention, who need that expert medical opinion, but are deprived, just because they happen to be, geographically challenged. is such a huge pain point. I mean, you take a district hospital with scores of people waiting for appointments, and you look at the situation only kind of differs from town to town and city to city in India. But for a mammoth country like India, this is an extremely huge problem. And the good part of it is you're bringing all the stakeholders together. Of course, the super specialty experts, the doctors, the right team members at your end, and of course the patients and the relatives, who I'm sure are going to be extremely, indebted to you for having provided this service. So keep up the good work. We just wanted to have this very, very short interaction with you, so that our hunters and spotters get an idea of the fabulous work that's happening in RXpert. We can conclude this interaction now. We do sincerely hope that you get spotted and hunted very soon. Best of luck, best wishes, Ramoji and Laksmoji, for the years ahead to come.
Thank you very much, Sachin. Thanks for the kind words. And then, I mean, you have always been encouraging with your appreciation always. Thank you very much.
Thank you so much.
Thanks, Sachin. Thanks for that wonderful interaction. I think we'll have more and more such interactions with the prospects, and yeah, we have a way we want to go ahead, and we want the right partners to put their shoulders along with our shoulders. That's what India needs, these kind of services, right? And we are right on the spot, and we want the like-minded people to come and join us and then encourage us. Let's do a big change in let's bring a big change in the society. That's more important.
Sure, absolutely. And like I said, once again, best of luck, best wishes. Thank you so much.
Thank you.